Our community didn't have access to health care. Doctors didn't speak Spanish, and our community wasn't treated with respect. And the undocumented were afraid to see a doctor because of their immigration status. And we're changing all that at Alivio.
For 25 years, Alivio Medical Center has been providing healthcare services to those who need it the most. The uninsured, the working poor, those that do not have access to healthcare due to language and cultural barriers, and those that are intimidated by traditional healthcare institutions because of their immigration status. Alivio Medical Center has become both a bridge and a safety net to thousands of Spanish-speaking, predominantly Mexican immigrants living in the Chicagoland area. This is their story.
Our people were getting sick, had no insurance, the doctors didn't understand them, they were undocumented, they had no trust, and had fear of the institutions that they were going to, and so many of them decided not to get any medical help.
25 years ago, Carmen Velasquez, a former social worker and community organizer, had a vision to create a medical center unlike any other. Carmen approaches Dr. Ann Garcelon and Sister Sheila of Mercy Hospital to join her cause.
Carmen and I have been friends for years, and I know her passion for healthcare issues as they impact the Mexican community. And I've been on the staff at Mercy Hospital and Medical Center, and I'm a friend of Sister Sheila Line. And each of us absolutely knows the need for healthcare delivery in the Mexican community. I from my own experience in my practice, Carmen from her community development work, and Sister Sheila. We just had not developed the vehicle to deliver.
I was here at Mercy Hospital, and I remember thinking we really need to be responding more to the Hispanic community, but we weren't able. And one day Dr. Garcelon came into my office and said, "Why aren't you doing more with the Hispanics?" And I said, I wish we could, but we need help. We need help to relate. And she said, "I'm just the person for you." Before I knew it, Dr. Garcelon came in with Carmen Velasquez, and in some ways you could say, and the rest is history.
Over the past 25 years, Alivio's bilingual, bicultural providers have served all patients, regardless of their ability to pay or their immigration status. These services include adult medicine, consisting of primary care with dedicated bilingual staff at all of their locations. Comprehensive diabetes care that includes community workshops to help understand and manage their diabetes.
Yo tengo aproximadamente un año viniendo a este programa. Se me ha controlado mucho mi diabetes, ya que yo la tenía muy descontrolada. No tengo palabras para agradecerle a ellos todo lo que han hecho por mí.
Prenatal care, including obstetrics, gynecology, and midwifery. Alivio's caring doctors and midwives make their parental program very unique. Here, couples are taught what to expect and what they should do during their pregnancy and labor, and how to care for the baby once it arrives. Pediatrics. Alivio is dedicated to the health and well-being of infants, children, adolescents, and young adults. Alivio's caring staff provides quality health care, including physical exams and immunizations.
Yo he sido paciente de Alivio durante 17 años. Recomiendo Alivio porque nos han tratado con respeto, con amabilidad, nos tratan como en familia y no discriminan a nadie.
Dentistry. Comprehensive dental care for children. It is the first not-for-profit, freestanding community health center in the Chicagoland area with state-of-the-art imaging equipment. Pharmacy. Bienestar is a full-service pharmacy that offers reduced-price medications to their patients, together with home delivery and patient consultations.
I love the pharmacy department because it makes our medication affordable.
Health fairs. Alivio reaches out to the community at various health fairs throughout the year. Alivio's Compañeros en Salud health promoters screen for potential health risks and serve as a link between the community and Alivio.
Una de las máximas satisfacciones para mí han sido darme cuenta de los servicios que Alivio ofrecía en la Feria de Salud por medio de Fiesta del Sol, ya que para mí fue una gran satisfacción darme cuenta que ellos me podían atender y ayudar a pesar de que yo no tengo seguro médico.
Community outreach and advocacy efforts in both immigration reform and universal health care is another element that sets Alivio apart from any other healthcare institution of its kind.
In the very beginning, we knew that Alivio Medical Center will be the medical home for our community, but we also knew that we will be advocates for universal health care, immigration reform, and workforce development.
In order to meet the challenges of tomorrow, the Alivio Board of Directors is comprised of leaders and residents of the very community that Alivio serves. In fact, the majority of the Board of Directors are also patients of Alivio.
I've been a patient of Alivio Medical Center since it opened its doors, and now I'm the president of the board. I've always been impressed with Alivio's mission because it offers our community health care and social services, especially the WIC program, which targets low-income families by providing supplemental nutrition for women, infants, and children.
What began 25 years ago as one clinic has grown to 4 health centers and 4 school-based clinics: Orozco Academy of Fine Arts and Sciences, John Spry Community School, Little Village Lawndale High School, and Benito Juarez Community Academy, and the community has benefited.
Es más que una clínica porque lo tratan a uno como una familia.
Yo vengo a las clínicas Alivio para recibir todos mis servicios, mis medicamentos, mis exámenes de las enfermedades que tengo y para prevenir las enfermedades que aún no tengo.
Doctores aquí en Alivio son muy dedicados a la salud de sus pacientes. Por eso, desde que era niña, desde los 10 años, mis padres me traían aquí a la clínica y ahora de adulta traigo a mi familia también a recibir los servicios.
The success of Alivio can be seen on the faces of its patients and their family members. For 25 years, they have been treated with respect, regardless of their ability to pay or their immigration status.
The number of uninsured is growing, not shrinking, and we need to continue to expand our services as the community continues to grow. There is still so much more to do.
Over the years, Alivio and Executive Director Carmen Velázquez have received numerous awards for their service to the community.
It wasn't easy back then to create Alivio, and it isn't easy now to maintain the cost, to continue to expand, to continue to serve. But what makes it possible, when I see the children, when I see the babies, when I see the adults who are trying to survive in a very incredible environment that we live in, I know we're doing the right thing. And I'm so proud to have been part of all this.
25 years ago, one person had a unique dream and vision to deliver needed healthcare services to the Hispanic community. And 25 years later, the dream continues to grow and flourish. Thank you, Carmen Velázquez, for showing us that one person can make a difference. Alivio Medical Center, serving those who need it the most.